Thank you so much for joining us this morning on this AFL Grand Final day for our Folix Uncovered webinar with Dr. Maxim Chumak. Before we get started, I wanted to let everybody know that all mics have been muted. However, you can ask questions via the question panel on your screen. And these questions will form part of our Q&A at the end of the presentation. So without further ado, I wanted to introduce Dr. Maxim Chumak, who has completed his medical degree in 2008 and then joined the US Army in 2010 in rank of captain and continues to serve as active Army Reserve. He graduated general surgery internship at Michigan State University in 2009. And he has been exclusively practicing hair restoration since 2016. Dr. Chumak was awarded a certificate of added qualification in the science of hair restoration surgery by the American Board of Hair Restoration Surgery. He is a voting member and presenting faculty at the International Society of Hair Restoration Surgery and is a diplomat of the American Board of Hair Restoration Surgery. Dr. Max, thank you so much for joining us this morning, your evening. You're in New York, I believe.
Actually, Florida, Pensacola, Florida.
Oh, okay, sorry, I thought you were in New York right now. Okay, so I'm going to hand over a presentation to you. Just give me 1 second. Thank you so much. And as I mentioned, everybody, please do ask questions throughout the presentation, and we will get to those questions at the end of Dr. Max's presentation. Thanks so much.
Thank you so much for such a nice presentation. A few words about myself. I've been practicing hair restoration for 13 years. Can you see my presentation?
It's come up.
Okay. Oh, yes. Sorry. Yeah, my screen somehow. Okay. So I've been practicing for 13 years, hair restoration exclusively. I've been involved in research development, both robotic technology, and I've been involved with Lumenis for last year as well. We have a training facility for doctors and we train over 100 doctors here at my practice here by Dr. Max. As you mentioned before, I served 14 years in the US Army, continue as a major when I have time once a month. Our facility is the patient care facility. I do both surgical and non-surgical treatments. We offer pretty much every modality we have in the market. Folix is now probably the most asked and probably the most potent solution we can offer to our patients. So let's talk about what our potential patient target population. So in the US, 50% of women will experience hair loss by age of 50. At the same time, man population is affected to much higher degree. 6% of men can experience hair loss by age of 35. And only in the United States, we have at least 80 million people with some type of hair loss that are our potential patient population. So looking at the statistics, 44% of men will feel self-conscious about their hair loss, and up to 35 of them, it can cause some psychological problems to feel unattractive due to their hair loss. And it's very interesting survey. So people were asked, in case of some financial constraints, what are they willing to give up? And if you can see here, hair care actually comes only above the skin hair. So only 9.9% are ready to cut spending on hair care, which is very promising for us. So what are the most common type of hair loss? And probably providers who are involved with treatment of hair loss, they will be very familiar, but some are not. So the most common is androgenetic alopecia. This is the most common type of hair loss. And this is probably the target population for us. Telogen effluvium is a form of hair loss triggered by excessive stress. There is a lot of release of stress hormone, cortisol, that can cause temporary shedding. Can we help with our laser therapy? I think, of course, we can mitigate the progression of telogen effluvium, and we can try to bring the regrowth much faster. And another category is alopecia areata. There are some good clinical evidence that it could help with regrowth of areas with exacerbation of alopecia areata. And I will show some small studies later. And another emerging category of hair loss is telogen effluvium related to recent increase in usage of GLP-1 medications. It is a real thing, and you can see Google search of Ozempic hair is skyrocketing. A lot of people will experience telogen effluvium as a result of weight loss medications. And we can try to help this patient category as well. So, at least in my practice, the 7% of clinic visits with complaints of hair loss are non-surgical patients. Only 30% will qualify for surgical intervention. And it differs, as you can see here. So typical surgical patients, only 13% are female. So majority of your female patients with hair loss will go into category of non-surgical treatments. There is some traditional solutions that we use in our practice. And I'm a strong believer that we need to combine multiple solutions to provide the best results for our patients. So the least reliable category in my with my experience is over-the-counter products. So there's multitude of companies that will overpromise their results, and usually those are empty promises. Nothing works, but people who are desperate with hair loss, obviously they will look for anything. And I think, and I explain to patients that we really need to stick to the clinical data to ensure that the treatment is being offered is reliable. So pharmaceuticals, a lot of patients will voice concerns regarding systemic side effects in case of medications such as finasteride, oral minoxidil. There's some variability in responses, require daily usage, and so on. PRP is very common treatment. I do perform it in my practice a lot. Here and there, I will encounter patient who will be afraid of needle sticks, painful, blood draw, and so on. So this is obviously a much better solution, as I will show in just a few minutes. And of course, transplant. Transplant is, by the way, it's not an exclusion criteria for Folix, quite the opposite. So people who do perform hair transplant, providers need to explain that hair transplant will not prevent hair loss. Our goal and final target with any treatment is to stop the progression. And Folix is the perfect solution because it targets hair follicles very specifically by providing growth factors, increased angiogenesis, and so on. So even after transplant and before transplant, our patients will benefit from Folix. Of course, there's another modality, low-level light therapy. There are a few studies with showing very modest results, and I don't think it could be just a solo treatment. It could be combined with other modalities, but I don't have a good experience to show that it actually works. And there are some devices that use all kind of technologies to try to deliver medications or serums, and using ultrasound waves, iontophoresis, and so on. And to me, it's still sort of investigational. There's no published good studies. There is no FDA clearance for, at least for iontophoresis devices. So we do have an unmet need from our patients. And here's some categories of patients we can encounter. For example, many patients, I don't want to give in into hair loss, but the medication side effect concern me, and I'm not ready for surgery. I hear it all the time. Sometimes patients are too far with the progression of hair loss, and surgery, that's the only option. But again, adjunct therapy is very important, and Folix is, I think it's a perfect solution here too. Here's the female patient. I know you think I'm crazy, but I'm losing my hair. What can I do what is not hormonal? So yes, that's a good option too. Patient who is afraid of needles, and PRP is no-go for me. I had a few patients like that. And your last category, college kids. You can talk to them as many times as you can, but to enforce compliance would be very difficult, because these guys taking medication or placing something on their scalp daily, it's almost an impossible task. So I think for them, this is one of the best solutions we can offer. So what is a Lumenis hair solution? Folix is the first FDA-cleared fractional laser for hair loss, and it's using 1565 nanometer non-ablative fiber layers, which is near infrared. It creates an areas of coagulation below the epidermis, which over time will release growth factors, stimulate angiogenesis, and stimulate nearby hair follicles. The treatment consists from 3 to 6 monthly treatments. In my clinic, I use TricoLab to get an objective data regarding response, and I can get the data about terminal to villus hair ratio, average diameter, and so on. So all objective data is analyzed every follow-up visit, and we can decide whether more treatments needs to be added. So the good thing about it, most of the time, no need for anesthesia. The handle itself contains cooling tip that will relieve most of the discomfort. And there's no downtime for the patient after the procedure. So here's how the porcine model looks like. As you can see here in the center, this is where the coagulation post-laser is. Basically, it's agglomeration of platelets that will release growth factors slowly. And you can see how evenly these foci are spread. So the nice thing about it, you don't have any missed spots. So every time you activate and trigger stimulation, it will evenly cover the entire area. What is remarkable here too, if you look at epidermis, it's absolutely intact, so there's no damage to epidermis. As explained earlier, it does stimulate angiogenesis, and nearly all growth factors are being triggered that it helps with hair growth. And what is remarkable, when you perform a PRP by itself, for example, your stimulation lasts between 3 to 5 days most of the time. Depends, of course, if you use activation, inactivated PRP, and so there are some variable factors. But here we can see a prolonged stimulation up to 3 weeks following the laser treatment. Here's some preclinical mice study where we used non-ablative fractional laser. And what we did, we measured the expression of both pathways, WNT and sonic hedgehog. And these both major players in hair follicle regeneration, development, and growth. So on the left, we have a control group. On the right, we have a low laser level therapy. And in the middle, we have different regimens, high intensity, low intensity, so on. So you can see, at least in 3 groups, we have a significantly higher expression of both SHH and WNT pathways. It's quite remarkable. And histology analysis on the right side showed complete resolution. As you can see, immunofluorescence, we have markers, red, green, and blue. And by day 21, as I mentioned, 3 weeks, there's a complete resolution and complete tissue repair. So we do have a much longer stimulation of hair follicles, up to 3 weeks. Here's some results. Some results come from Dr. Sadiq. Some results are from my clinic. So here, a female patient who had 5 treatments with Folix, and you can see a significant regrowth of the central mid-scalp area of hair loss. There's a patient with typical female pattern alopecia. Here's my patient, very happy patient, 5 treatments with Folix. And you can see almost complete resolution of crown thinning, and the frontal area looks very remarkable. Here's another patient of mine, also very good results, much thicker hair, and I'll show some later on. I show some trichoscopy images as well. Another female patient of mine had 5 treatments, very good results as well. Here's another patient. You can see almost complete resolution of thinning in the crown area. Also very happy patient. Another patient from my clinic, female pattern alopecia, Christmas tree pattern, of course. You can see very good results. Oh, here's an interesting patient, and by the way, he's not only one. So this patient underwent hair transplant, and he came for his follow-up at 4 months. And what I've noticed, that his results are much faster than what I expect at 4 months. So typically what I see here with hair regrowth usually happens between 6 to 7 months, sometimes 12 months. And this patient is a little older. He's close to 70 years old. And with older patients, we're always concerned about level of perfusion. There is atherosclerosis, and of course the growth is great. So he was treated with 1 treatment with Folix before the treatment, and then he come back a month after the surgery for the 2nd treatment, and 2 months after the surgery. And you can see very good regrowth, much better than what is expected at this stage postoperatively. Another female patient, that's from Dr. Sadiq, also very good results. I said your female patients is probably one of the best because most of the time surgery is not an answer and we need to do something else. Another patient from Dr. Sadiq. After four treatments with Folix. Here's me, and I had 4 treatments. So this is my time when I was during my basic officer training in 2015. And if you look at my hair now, I never had a hair transplant, but actually tried 4 treatments with Folix, and I think they look a little bit better than almost 11 years ago. Okay, so let's play a little video how the typical treatment works. You have automatic activation. You move after the hair being parted. You click on the trigger, and you move it continuously, so you don't skip any parts of the scalp. So as I said previously, we can start treatment plan anywhere from 3 to 4 treatments, get follow-ups and see how we respond. We can have we have patients with early response, late response, and we can adjust our treatment plan accordingly. So maintenance treatment between 2 to 3 treatments per year. So the good thing about it is creates a source for revenue for your clinic, because patient will like the result. You always emphasize that it does require maintenance, and they come back to you. So when we talk about ROI, I can I would say, yes, I can reassure that in my case, it was probably one of the best investments I had, because it really found its place in my practice. And I had this unfilled niche that needed a perfect solution that I pretty much can apply to any patient with hair loss. So I had this device for over a year now, and probably it's been utilized at least on average 2 to 3 times a day. So I had close to 350 patients treated so far. So as I mentioned before, some of the factors that play a role here and are attractive for our patients. There are no chemicals, no needles, no surgery. We have proven results. There is no pre and post-op care. It usually takes about 30 minutes, and once you train your personnel, you can delegate this procedure easily. So most of the time, I would say 99% of the time, there is no need for anesthesia. I had 2 patients, and you always will have someone who is very, very sensitive. There's nothing you can do. And again, you explain, okay, we'll inject a little bit of lidocaine and help this patient. But again, 99% of the time, there's no need for anesthesia. So here's another study was performed by Dr. Abram and Jerry Shapiro. So it was an observation study of 98 patients, aged from 21 to 66. Subjects completed a series of 3 to 6 monthly laser treatments, and they had 3 independent US board certified dermatologists who had to evaluate the results. So assigned dermatologists identified 96.9% of the images correctly, and the success rate reported for male subjects with and number was 47 was 97.9%, and female subject were evaluated with substantial improvement at 96.1%. Here's another study from Dr. Mark Abram. He evaluated 9 androgenetic alopecia patients. They were treated with Lumenis fractional laser as well. It had 5 males and 4 females. Fitzpatrick from improved category 2 through 4 had a 7 Caucasian, 1 Hispanic, and 1 African American, which is off-label, obviously. So patients were evaluated at 1 month post last treatment, and they found 8 out of 9 cases a significant difference. So as you can see here, for the female range was from 4% to 12% improvement in total hair count per square centimeter. Male from 6 to 21. Mean result was 8% for female, 13% for male. Here's a result from Tricoscan from the same study. As you can see here, we measured the total number of hairs per square centimeter. This is the sum of hair, and we went from 6,293 to 7,246. And this one patient, as well as hair count per square centimeter from 141 to 165, quite a significant difference. And second patient also showed promising result. Hair count per square centimeter went from 149, and we talked about terminal hair, of course, 149 to 165. A small study involved patients with alopecia areata. Again, it is an off-label indication. So 7 patients were treated with 10 laser treatment per patient. The follow-up visit at 3 months post last treatment, and the main findings were significant to new growth of 137.6 hair observed in follow-up. And you can see some examples from before and final pictures of these patients. So this is something I've been trying in my clinic. It is a combination of PRP treatment with Folix. Again, it is off-label, but I like to share it because I found it very effective. And my rationale here was, if we use Folix to create coagulative foci, what if I'm to inject high concentration of platelets prior to performing Folix? So I will have 20 times more platelets injected pre-exposure with Folix, and hopefully it will help me to create more potent coagulation and higher release of growth factor, higher angiogenesis. Okay, so that's exactly what I'm doing here. I'm using an automatic injector device that targets very precisely to 3 millimeter. I actually measure it with ultrasound. Then, of course, we dry the hair. Hair has to be dry 100% before we can use it. And we continue with Folix on top of it. And what I found using the TricoLab data, that after 1 month, I had a significant improvement. As you can see here, there's almost non-vellus hair. There's a big resolution of the thinning, majority of hair follicle, and we're talking about just 1 month after this treatment. And some objective data to show just 1 month after combination of PRP and Folix. So our hair rate vellus count was 24%, and it went to half to 12%. Our terminal hair count 96 to 123, and when I saw it, I was very surprised myself. And it's always nice when you make an assumption and you can validate it objectively later. So what are the indications for use? It's defined as improving the appearance of scalp hair in adult male and females with Fitzpatrick skin types 1 to 4. Can you treat patients Fitzpatrick 5? I think yes, it's going to be off-label. I treat them. and you want to make sure you try a small area before you actually offer it for the full area. That's what I do for off-label patient. We go maybe 1 or 2 activation, looking at the result the next day. There's no problem. We treat the entire area. What are the warning risks before usage? So you need to instruct your patients after the treatment, avoid direct sun exposure for 7 days. So just wearing a hat is sufficient. You can advise about possible just minor hair shedding. Does it happen very often? No, it does not happen very often, but you need to warn your patients. And it's not a bad prognostic factor. It's actually a good prognostic factor. And most of the time when we have this temporary shedding, it actually it will give much better results in a few months. And I had a patient like that was very worried, but when we evaluated her in 2 months, she was very happy and she was very thankful for the treatment. So, of course, any concurrent history of skin cancer or pre-cancer lesions, it's a contraindication. You need to examine the scalp, making sure there's no actinic keratosis. There's nothing that can be precancerous. Active infection, fungal, bacterial disease should not be treated in the area of exposure to laser. And when you have your training, you're going to have a user manual with more detailed warning and risks. So from the standpoint of investment, again, I wanted to reiterate it was probably one of the best investments I made. I had a lot of purchases that were collecting dust for many years, and this purchase was actually generating a revenue on week 2. And of course, you need to be active on social media. You need to post. You need to engage with potential patients. But if you are in the business of hair restoration, I think this is one of the best devices you can add to your arsenal. Now I can take questions.
Great, thank you so much. We have a few questions here. So first question is, how does Folix differentiate from other machines or other non-ablative fractional lasers on the market? This person has seen other clinics using similar technologies for hair as well. I'm not sure if they're TGA approved or not, but she's definitely come across some other fractional lasers.
Yes, of course. So what differentiates Folix is full FDA approval and abundance of good statistical data that you can offer your patients. Of course, there are devices that can resemble, but I think it lacks all the scientific foundation to use it. And at least for us, and I'm sure FDA is being kind of the governing body or a reference body all around the world. I think it does help to convince your patients that it's probably a better solution.
Another question, is it possible to use Folix for the eyebrows?
Yes. The rationale here, we are creating areas of growth factor release. So it can work with beard. I had patients who wanted to grow thicker beard, and it did help them as well. And it can work with eyebrows. Of course, it is off-label. You need to make sure you cover eyes. You don't want to have any exposure to a laser into iris, of course. And but I think yes, it's one of the very good solutions.
Fantastic. As a female, we love to hear that. Would you also recommend combining Folix with topical application applications such as exosomes?
Yes, excellent question. So even epidermis remains intact, but the areas where it was exposed, you can actually see small dots that can facilitate delivery of any substance you can apply on the scalp. So, for example, you can use dutasteride, you can use exosomes, you can use even PRP. Instead of injecting, you can apply PRP, and it can help with facilitating delivery of any substance subdermally.
And what is the recommended waiting time between a hair transplant and Folix treatments, and which would you do first?
So I can relate to my experience. Again, there's no study, and everything what we do is kind of by applying the best scientific guess. So looking at the way Folix works, most of the probably the largest expression of WNT pathways happens approximately 3 days after. So I try to schedule Folix between 3 to 5 days prior to surgery. I think if you do it the day before, you will not gain all the benefits. So I think we need to schedule at least 3 days, maybe 5 days prior to the procedure. And then I wait for 1 month after the surgery for the first treatment, for the second treatment post-operatively, and the third treatment at 2 months.
Okay, excellent. Regarding the potential risk of pigmentation problems, is that regarding the hair itself specifically? And is it because it's attracted to the melanocyte?
Pigmentation is extremely rare, and I haven't seen increased pigmentation in any of my patients. Especially, if you use it in the hair area, so slight pigmentation, I don't think it's going to be an issue. And most of the time, melanin is not being affected significantly, melanin production.
How many sessions on average do you find necessary for optimal outcomes? And how often do you recommend maintenance post the initial treatments?
Yeah, so we start with 3 treatments scheduled. And the typical price we charge is $1,000 per treatment. Every time patients come back, and as I show my way to drive the objective data, patient get evaluated with trichoscopy on every visit, and we calculate the improvement. If I see enough improvement during first treatments, we can probably omit the rest of the treatments and wait another year to repeat. So maintenance usually between 2 to 3 treatments. And as I mentioned before, it does help to create a steady revenue for your practice. And you always mention it during the first consultation that it's one of those therapies that does require yearly maintenance treatment.
Okay, perfect. I have one last question here, which is what advice would you give to an aesthetic clinic making its first investment within the hair regrowth area?
Well, when you have an aesthetic practice, if you remember statistic we discussed in the beginning, almost half of your patients, male patients who are 35 years old, will have problem with hair loss. So every time you see someone who is coming to unrelated issue, you may raise an awareness, and you can ask, okay, we have a solution, we can help you with hair loss. Of course, you need to establish practice or that can help with hair loss. So Folix is one of the things you can offer, but you need to get some equipment. For example, trichoscopy. I think it's very important for educational purposes and being able to monitor results. If you're just starting with hair restoration, I would suggest attending some conferences so you can learn the basics of hair restoration, because you want to be able to help your patient in from the educational, well-educated perspective. Folix, again, is a great solution, but you need to have something else also. I believe that a lot of time we treat patients with several modalities because we see the best results from the synergy of different modalities.
Wonderful. Well, that is all the questions that we have. Thank you so much, Dr. Max, for your time. I know it's Friday evening there, so you've probably earned a well-earned drink this evening. So thank you again for your time. We really appreciate it. Thank you so much.
Thank you so much. It was good.
Excellent. So with that, I will now close out the webinar. Thank you so much.
All right. Thank you. We'll be in touch.
Thank you.